Hello, everyone. Foremost, I would like to thank the class of Mr. Ryan Rubang, specifically the BSN4C, for organizing this worthy webinar entitled Hakbang, Designing Your Way Forward, a webinar for graduating student nurses. And for this time, I was tasked to deliver or to share some insights, experiences, information, and hopefully inspiration to you as far as your preparation for the real world of work is concerned. Allow me to share my presentation. So I entitled my presentation, Cope, Improve, Accelerate, Taking a Leap for Your Future. We know very well that we've been into the height of the pandemic in the last 2 years, and we're still coping. We're still navigating. We're still continuously are doing our best to actually do things despite the difficulties at the moment. And we are also continuously improving because, as they say, there's no other way to go but to continuously improve ourselves. And finally, accelerate means that we do our best to be better each day, that whatever we achieve right now, we should achieve more in the future. We should continuously add more knowledge to us, and of course, our competencies, we continuously enhance. And so I'm Virgo Lopez, your faculty in the College of Nursing. I handled the classes of NLM for prelims, and I'm happy to see everyone again. And for our guests, for our fellow faculty members, good day to everyone. The expectations for my presentation include what will happen after your graduation. I know this is a common question among our graduates that, so ano na ngayon? Ano na ating gagawin? So more expectations would arise as you finish your education because it's time for you to give back. It's time for you to pay it forward, right? And so there will also be strategies and tips for the exams, specifically the nurse's licensure examination and the other exams like IELTS, NCLEX, and so on. And finally, there will be challenges and opportunities that you have to know so that you can better maximize the many opportunities waiting for you. And the target, specifically, I will be presenting realities of the nursing profession in the ever-changing world. I would also share tips. These tips are actually personal, that are cultivated through the years, that may be applicable to you or not, but with tweaking, it might work, all right? For you to have a successful career, may it be in the bounds of nursing, or whether you become nurse entrepreneurs, for example, and so on later on. We could have this baseline or benchmark for us to do well in our chosen path. And also, I hope to inspire you, the next in line, to continue to believe in yourself and to achieve more, not only for yourself, but for others. Let me begin now with a reality check or emotion check. How are you these past days? The exam is upcoming, right? It's the end of the year. It's December, by the way. It's the best month of the year, as they say. Kumusta kayong lahat? Kindly type in the chat box, or at least say it in your way that I'm inspired, I'm happy, I'm amused, I'm neutral. Or if you also have these feelings that you're annoyed, sad, angry, and afraid, they are valid feelings. And I hope you can overcome them and you can turn them to something positive. All right? So let's get going. The reality of the world is this. We are living in the world which is known to be VUCA. This is the acronym for volatile, uncertain, complex, and ambiguous. Quickly, let me tell you the highlight of each word. The world is volatile, meaning we are demanded to act with so many changes in the world these days, right? Who have ever thought that we would be in lockdown for a year or more, right? So indeed, these changes compel us to actually do something, to respond to them, right? And the letter U, uncertain. Most of our fears would be the fear of the unknown. As nurses, you know this, right? Therefore, the things that we don't know stresses us, right? It makes us really feel like it's hard to live, right? So things that are unpredictable, it actually gives us anxiety, right? Letter C, complex. Of course, who would say that life is easy, right? There are a lot of surprises, and coupled with the surprises are the difficulties, right, that we have to face, that we have to overcome. And finally, letter A, ambiguous. The world is ever changing. Like your gadgets, right? The model of your phones, they change quickly. And so the world becomes unfamiliar to us. And then there are competencies required of us to develop, right? Who would ever thought that digital intelligence is the name of the game now? Agility quotient or agility intelligence, right? For us to be able to face the challenges ahead. So these are the prevailing words that press our world today. And so, how do we get by and how do we actually live amidst these realities? So, instead of volatility that because of changes we are demanded to act promptly or immediately, instead of uncertainty, instead of complexity and ambiguity, I would propose, based on the suggestion of my mentor, Dr. Carl Balita, that volatility should be changed with vision. That if you never fail, right, to envision the future, meaning as early as now, you should know what to do already, meaning you have already your plans. For example, for the coming months, for the start of the second semester, do you have a plan already apart from enrolling? Or do you have already the plan to apply immediately after passing the board exam? So vision is about your future purpose. Usually it lasts for 3 to 5 years. It's for long term. So when we have our vision, things may have changed or may change, and the world may demand from us things. With our vision, we would be anchored properly. Now, instead of uncertainty, we have to have understanding of the things happening around us. What do I mean by that? With the pandemic, most of us said, "Oh, I don't want already to go to school. You know, I just want to stay home. I'm stressed." Although these are all truth, right? But understanding the situation requires us actually to reflect, right? And once we reflect, there is understanding. And once there's understanding, it's easier for us to accept things. We hope that in the future, if there are difficulties that you would face, pause, reflect, and understand. It may take some time, but you know what? If you would be able to reach that point where you understand things, acceptance would go next. It should never be difficult to actually face them. Instead of complexities, we invest in clarity of our roles and our functions, meaning, do we really know the very essence of being a nurse in this world of diseases, in this world of a lot of complications? So clarity means that, do we know exactly our purpose? Do we know exactly our passion? And we hope by now you already have an answer to that. Do you know what you want? So there should be clarity. Because if you know what you want, if you know your purpose, it would never be difficult to actually work, right? And finally, ambiguity should be changed to agility. Agility simply means flexibility, right? There are idealists. It would be normal that after graduation, you will be idealist, meaning, oh, we should follow the rules. We should stick to this. It should be done this way. But you know what? In order for you to have collaboration and to work better with others, like with the healthcare team members or anyone in the healthcare setting or any sector, agility or flexibility requires you to actually adapt, to adjust accordingly. I'm not saying that you sacrifice your values, but my point is that when you need to adjust to have better results, not necessarily your integrity, of course, that's a different story, then you do so, all right? You adapt, you go on with the flow as needed, all right? So these are the things that should guide us, that instead of the VUCA, volatile, uncertainty, complexity, and ambiguity, the green ones, having the vision, understanding, clarity, and agility, should guide us better. Okay, Relative to that is I have been talking about purpose, right? And there's this Japanese term, ikigai, which means our life purpose. I hope you were able to search for it, or if not, this presentation is for you. So let me share to you that there are things that we love doing. Most of you love sports, basketball, for example, you're an athletic. Most of you love reading, right? Most of you love watching in Netflix, via Netflix rather, and so on. So, do we know what we love? Now, another thing would be what I am good at, our strengths, right? You're good at singing, you have the musical prowess, you can dance, you're multi-talented, you have these competencies that people look up to you. What the world needs, less of us actually focus here, meaning do we have that consideration of what the world needs? For example, nurses are needed this time more than ever, right? So you're in the right track, you're in the right profession. And finally, what I am paid for. Whether we like it or not, most of you, or us rather, became nurses or took this path because it's a well-paying job, especially when you go abroad. And I'm sure one of your goals, one of your plans is to actually practice nursing in the international arena, right? Because of the greener pasture waiting for you. But let's dig deeper to these points of our ikigai. So everything is here, the interconnection of things. What you are good at and what you are paid for is what you call your profession, the nursing profession, meaning you should be good at this. You should know basically how to take vital signs, interpret, report the results, and then based on these data, you could come up with viable nursing interventions. So you should be good at this. What you are paid for means that with RA 9173, right, salary grade 15, that we should be paid well. So that's all about our profession. However, what we are paid for and what the world needs is actually our vocation, meaning we are paid for this job, but actually this is needed these days, like nursing. So this is considered to be your vocation because you're needed in the hospitals. As they say, you're the lung of the hospital, right? You're the foundation of the hospital in the sense that you are really vital. We are really vital in the bedside care. What you are good at and what you love is actually your passion, meaning gustong-gusto mo ito. May I see a heart sign and at least comments in the chat box that indeed you love this? Can we have a reaction of hearts? And can we type, I love this? Yeah. So if you love this is your passion. Finally, what you love and what the world needs is actually your mission. All right. Meaning this is your present purpose. You have the responsibility to fulfill this. And then all of this, when connected, actually would comprise our purpose. Okay. So we hope that you're still with me. So purpose then is the ikigai. All right. Where I hope by now you're starting to find it, look for it, right? But beyond these interconnected circles, let's dig deeper, all right? Let's say your passion and your profession, meaning you love what you're doing, you're good at it, you are paid for it. That would be satisfaction with usefulness, meaning you're okay, right? You do what you love, but there's uselessness. Why? Because it's not what the world needs, all right? Let's have another. Your passion and your mission, what would it make you? It would give you delight, meaning it will give you joy. However, no wealth because you will not be paid for properly, right? I know some of you would say, oh, I will just volunteer and so on. That's fine. But whether we like it or not, we need resources to get by. Our family members need, of course, to be supported, right? So we need money. We need our salary, remuneration, or what have you. So remember, you may have your passion, you may be fulfilling your mission, but you don't have money. Let me say that teachers at some point are like this, that you've been a teacher for 30 years, yet, you don't have money, you don't have any investment. You might say that it may be the fault of the teachers, but at some point, there are just teachers who really just willing to serve, all right, beyond anything else. But I'm not saying we should limit ourselves to that because we need also money, whether we like it or not. May I say a thumbs up if that's true? Okay. Next, what could be our profession and vocation? Meaning, we're good at it, we're paid for it, that's what the world needs. There's comfort, right? That, oh, we're secure. But there's emptiness. Why? Why is there emptiness? Because it's not what you love. Yes, you're good at it, but it's not what you love. So there's a concern there. You might be being paid for so high, but there are those nurses abroad who say, I would rather go home, and plant kamote on, but this is a joke, of course. My point is, you're not only being paid for, supposedly. You should also love what you're doing, right? So these are values that you have to settle internally later on. Now, what would happen if you have the mission and vocation, but you're not actually good at it? There's excitement that you want to go to work, to office, but there's uncertainty. Why? There is competition. This is what I'm saying when we say that we should be lifelong learners because competition out there, whether it's positive competition or not, there will come a time that it's really the survival of the fittest. Only those who are good at what they're doing would be retained, especially now that we have artificial intelligence, for example, the emergence of technology. So can we say still that it's okay for you to serve, it's okay still for you to teach, whether or not you are good at technology? Of course, it's already a plus point. It's already an edge when you're good at something else. Like we should be able to maximize our competency in nursing informatics because this could be the work of the future, right? At some point when we were in fourth year, we were saying, para saan ba yung nursing informatics? Ano to, tayo, transcriptionist or whatnot? But they're happening right now. There are nurses who are transcriptionists. There are nurses who come up with, or who are coming up rather, with websites in this class. For example, in your batch, some of you have researches related to a mobile application for health, and that's good, all right? So we continuously hone our skills. Now, presenting all of these, what's then is the most important thing? I would like to type in the chat box, is it passion, mission, profession, or vocation that matters? Okay, I will give you some time to do that. Of course, you may prioritize passion, right? Because you love this. Or some of you would say vocation or profession. Okay, let me give you last 10 seconds to type in the chat box. Among all of these, if you would choose one for you to prioritize, what would it be? Okay. For me personally, it's still passion, something that let me get by is actually passion. If there are times where I would find it so difficult to wake up, I mean, even if you wake up or you woke up and then go to the university, something that would actually go back is, bakit mo ba kasi ginagawa ito? Para kanino mo ba ito ginagawa? So, about passion. But more than that, okay, time's up. We would see there are probably varied answers. But why would you choose one if you could choose everything into one? And that's actually purpose. That's why, let me tell you, that purpose is ikigai, our reason for being, our reason of our existence. So I hope you find your passion in nursing, that this profession is really for you, that you consider this as your vocation to give back, and this is your mission actually to fulfill. Okay, so can we give ourselves a virtual clap for deciding today that we should have the purpose in nursing? Now, speaking of purpose, life-giving force, that's the other term for purpose. We should all aspire to continuously make a difference in the lives of everyone we meet, because making a difference is actually the prevailing aim of everyone, supposedly. Because if our goal is only to go to work, finish the 8-hour duty, there's no fulfillment there. But if we have this end in mind to make a difference in the life of our patients, each patient that we would handle, then it would be different. The feeling would be far different. Now, Speaking of vision a while ago, begin with an end in mind. Again, why are you a nurse? Why do you want to become a clinical nurse? Why do you want to become a nurse educator, for example? Envision the brighter future for you, your significant others, and all. But mind you, I would like to present this reality that in vernacular, di ba palagi natin sinasabi, mag-aral kang mabuti para hindi ka magsaka, di ba?Ag-eskwela ka nga na saya at madi kang mapudutan di taltalon. These words are actually being said. In English, you should be able to study well so that you wouldn't be like those people who are on the streets. You hear this. And let me correct that, all right? I would like to correct that beyond those words, yeah, there might be truth to that when our parents say, "Wag niyo kaming gagayahin." 'Di ba? Na kaya kayo pinag-aaral para na sa ganun, hindi kayo magaya sa amin. But what pains me is the idea that mag-aral ka na mabuti para hindi ka maging katulad niya. We should change that paradigm into something like, you should study well, you should be better in your schooling or in your studies so that you would have a better life, better life for your family, and for everyone. So sana, sa pagiging nurse mo, yung mga nasa pamayanan, nasa komunidad, the very essence of community health nursing is that they might not have studied, but through you, because you studied well, you would deliver the best health education you could give so that they will no longer be sick or hindi na sila ganun kalala yung kanilang mararamdaman. Kasi sila ay natulungan sa pamamagitan ng impormasyon na mababahagi mo. If you're a teacher, for example, you study well and be the best teacher you can be so that yung mga bata ay patuloy na mangarap at magkaroon syempre ng inspirasyon na natuparin ang kanilang gustong makamit sa buhay. Hindi sila magsaka lamang pagkos mas mapabuti ang kanilang buhay. My very point is that we should not limit the result of what we're doing to ourselves and to our significant others. Pero sana dumating yung pagkakataon na kailangan ko mag-aral ng mabuti, hindi lamang para sa aking sarili, sa aking pamilya, bagkos para sa aking mga magiging pasyente, para sa iba. So gone are the days that we would say, mag-aral ka para hindi ka magaya dito sa tambay na ito or whatnot. You can be a politician someday because of studying well. And if becoming politician would help this tambay to have a better life later on, that's something else. And I hope you can commit to do that. Okay? Now, going further, apart from having an end in mind, this is the time where I would zero in the nursing profession. To become an RN, these are the tips I could share with you based on my experience and based on my observation for the last 10 years or a decade of being able to finish Bachelor of Science in Nursing. What a coincidence. 2012, I finished Bachelor of Science in Nursing, and 2022, a decade after. I'm here sharing some insights to the next in line. The first is nurture your compassion and purpose. I would not say more about this already, but my point is you should love what you're doing, and there should be a deeper reason why you're doing this, why you are a nurse. And it's highlighted here, beyond passion, there should be compassion. Meaning, dapat hindi mo lang gusto ito, bagkus dahil sa kagustuhan mong magsilbi, meron kang magiging malasakit sa iba. You would feel for others. You would empathize for others. The second bullet is use your common sense. What do I mean by that? Most of our activities in the hospital are practical, meaning it does not need actually anatomy and physiology that much, all right? To be able to care that. For example, if your patient grimaces, you know that there's something wrong. So common sense would tell you, you have to ask, you have to assess further because the patient might be in pain, right? So common sense would tell us, these are the practical things that you must know. Being street smart, for example. Having the initiative or yung pagkukusa ba. Next, remember content. In the board exam or in any qualifying exam, content matters. So these are about theories. So you should be able to understand the concepts discussed in class, right? You should be able to read more, read. Mind you, reading matters. What else? Sustain competency and creativity. So beyond concepts. Kaya nga sinasabi nila, di ba? Ang mga taga-UC talagang nasa practice, nasa competency, you know. You might not memorize the baseline data, for example, or concepts, but when you work, actually, talaga namang kitang-kita yung kagalingan sa kilos. So we enrich our competency and creativity by engaging ourselves with trainings, right? More than webinars, trainings. If there are free trainings in the hospitals or in the area, find time to actually learn from them. And mind you, don't just go after the certificate. It could come, it's secondary, but you should be able to fulfill ano ba yung natutunan ko sa training and then apply, right? Creativity also is resourcefulness. Kailangan na kailangan yan sa komunidad. O pag walang resource, anong gagawin? Gamitin ang mga available resources sa pamayanan. You've been taught well with that. And finally, employ test-taking strategies. Test-taking strategies would mean yung time management, you know, in any exam. You've been taking exam for quite some time now, for so many times in your college days. But time management matter. Ilang minuto ba kada item ang gagamitin mo or ang gugugulin mo? So in here, you may say a minute or two, but you know, the lesser time for each item, the better, because your goal is to finish the entire exam. What am I saying? If there are 100 items, and even if you answer the first 50 items correctly, but you don't have time already to finish 51 to 100, you could still barely pass, right? Instead, if you equally provided time per item and you move forward, if you don't know the answer after putting as asterisk to the probable or viable answer, you would be able to finish the exam on time, and that would give you more chance of passing it. All right. There will become also time where you would have IELTS or language tests or the occupational English test, the OET. And in here, develop the competency actually to speak, to write, you know, to listen, to read. So test-taking strategies would mean that you should be able to answer questions each day. This is a practical tip. When I was taking the board exam or about to take the board exams, I've taken 2 exams, by the way, and 1 government exam, the civil service. I committed to actually answer 50 to 100 items every single night. And if you can even increase that to 200 per day, why not? Why? This is developing your agility, your fortitude. Marami sa inyo pag nag-exam na, di ba, inaantok, ganyan, o hindi na matatapos. So you would resort to just mini-mini mo. Whereas, if you really learn how to develop the concentration by answering questions each day on the day of the exam, you should actually focus more. All right. So these are just some tips or strategies for taking the exam. Okay. There will be more when you enroll for the review center and when you have your group study sessions. Here, I know you have your messenger groups where, you know, Marites would be the name of the game, but more than Marites concerns. How about coming up with a messenger group where you could share materials there that you have found via internet or good material to be read so that it becomes an academic, you know, engagement. And interaction matters because there's learning when you interact with others and be with the right group, okay? And if there is a member who's not performing well, then you must be able to inspire him or her to be with you. Now, to exploit work opportunities after graduation, that would be in less than a year or less than 6 months. By the way, as you can see, to become an RN, that is nurse, all right? There, that's the acronym that I've made. Now, to exploit work opportunities, you should be able to win over barriers. You are born to excel. There might be difficulties ahead of you, but learning from them matters, all right? If you commit a mistake, that's fine. The most important thing is you learn from them. As we say, there are no mistakes, just lessons. Excel, all right? Next, observe and learn from others. You don't need to be the one to actually feel the pain or to fail before you learn. By merely observation, you're already learning. That's why when you go to duty with your clinical instructors, you observe, you ask the right questions. When you have the preceptors later on, you observe for quite some time and then you volunteer to do it with the supervision. Should never go wrong in developing the competency. All right. Experience. Next, I would like to highlight this risk taking, specifically calculated risk. This is different from bahala na. That's mediocrity. Okay. Again, let me specify. Risk taking here is more of the readiness to accept anything, like what would be given to you. All right. For example, there's an opening to become a head nurse and you are tapped. Most people who are limited to their comfort zones would say, oh, I'm shy. Oh, I cannot still do it. I'm young, blah, blah, blah. But risk taking means that you know very well that you have something in there. You have a potential. So taking this chance to actually grab the position for you to learn more and for you to become better would be the answer. So calculated risk taking is the key. You explore. If I may say, those successful people are not the ones who are really lucky. All right. I must say, the successful ones or career people are those who are ready, or even if they're not ready, they have accepted the opportunity right there and then, and they learn how to do better afterwards. What do I mean? There was a time in 2016 when I was teaching in Baguio, and I was already love teaching. Suddenly, Dr. Carl Balita invited me to go to Jakarta, Indonesia, to teach Indonesian nurses the English language. So English language in the context of nursing. So he knew that I was teaching English because that was my first job. And I'm a teacher, really by profession, apart from I'm a nurse. So looking back, if I did not accept that offer, if I said that time, oh sir, I'm sorry, I'm not practicing nursing in the hospital. Oh, I'm a teacher, I'm busy with work, blah, blah, blah. I should have not developed other parts of my competency. And that is to develop more my competence in speaking. What else? My competence in collaborating with others. What else? My transcultural nursing, because that's an avenue where you would learn from Indonesian nurses, where I learned to engage with the doctors and I learned to know the processes in that hospital. So that kind of exploration. So again, if you're offered a job, you're not being offered because you're not the choice. You're the choice. And they have seen potential in you. Grab it. Okay? Risk taking. Finally, kindness and right intentions will never be wrong. Meaning, if there would be problems later on because of character assassination, let me say that way, or for example, because of your colleagues who are backstabbing you or whatnot, these are normal. But once you are kind and you have the purest intentions of all, they might just, destroy you in any way with words and so on. But kindness and right intentions would always protect you. So be kind, okay? Be good, because you will never go wrong with that. So what's the acronym here? Work. Work well. Accept the work, all right? Go out of your comfort zones. Now, dealing with stressful situations at work, you prioritize. You don't need to deal with everything one task at a time. One day at a time. Don't stress yourself. Mind over matter. You manifest, you claim it, you think that you can do it, all right? Your mind is so powerful. Have an optimistic and growth mindset, meaning growth mindset means you continuously learn, be a lifelong learner, accept opportunities, soar, all right? Laugh, learn, and live. The last three L's, laugh. You know what? You don't need to be serious. Life's so serious already. A good dose of good dose of humor would help. Learn. There are so many things to learn. I myself is learning. I'm learning from you. You may learn from me. We learn from each other. Live, right? When you say live, is that be human and be humane. Okay. Now, overcoming challenges, look at every difficulty as an opportunity to become better. It's hard, once you're already about to give up, you just say, no, I have survived a lot of battles in the past. I would survive this, okay? And my last slide for this presentation would be, these 5 things I would like you to really focus on that I am hoping that you would do. The first bullet, do the right thing. There will be pressures later on. You do this, you do that, I'll promote you in exchange of this. You stick to your values, right? You stick to your integrity. As I said, you will never go wrong with kindness and the right intentions. Do the right thing. Be the leader, all right? Contribute and share your best self, altruism, and I hope as nurses, nananalaytay dapat ito sa ating dugo at kaluluwa. Altruism that amidst you sacrificing yourself for others, that's actually heroic, correct? But we don't want to become dramatic there. My point only is beyond yourself, subordination of self. You're doing things beyond yourself. It's for the benefit of our clients, our patients. It would be more than you. Lead and serve. We need more leaders this time, especially in the nursing profession. Who knows? You can be the next, right, members or chairperson of the board of nursing who would continuously improve our profession. Make a difference, right? Always ask yourself, what have I done, right? Did I at least change something? If your answer is yes, you're doing well. And finally, nurses of the future, live life to the fullest. You always go back to the time, do I want this? Do I have a deeper purpose of becoming a nurse? If your answer is yes to these two questions, then you're destined to become one, to be like us, and to be in this profession where we should serve, we should care, and we should lead for the benefit of everyone. On that note, congratulations, class of 2023. Nalalapit na ang inyong pagtatapos. At kapag kayo na ay nag-graduate, you pass the board exam, you apply to the different institutions looking for you, look for them, look for you, and it should be a good world of work and world of opportunities and world of great nurses like you. Maraming salamat.